Well, that's an overview of topical products. And as you can see, there are local and transdermal products, both of which are very effective. And I have found that it gives me the relief I need, especially when I've been, let's just say my knees hurt, my wrist hurt. And I have people that I've worked with that have arthritis, and it's a tremendous product to help people with arthritis. Now, that being said, let's jump into some of the questions that were asked prior to the webinar that you submitted. Let's get you some answers to those. First question is, it's hard for me to fall asleep due to neuropathy in my feet. I use tropical THC cream, a vape, and a THC capsule still in pain. This is a good question because it's a matter of, not only the product that you're using, but also I would recommend you take a look at the terpenes that are in the products that you use, especially, for example, the vape and if possible, the THC capsule and the cream. Now, let me be very, very specific. Neuropathy is something where it is affecting your nerves. And what you want to do is you want to tap into the neuroprotectant capability of medical cannabis. Now, what do you mean by neuroprotectant? Cannabis has the ability, especially CBD, has the capability. So does THC, but CBD is really something that is known for a neuroprotectant capability. And what that does is it works with your receptors to coat your receptors, especially if, in the case of neuropathy, when that sheath has been removed. Now, it's not going to repair them, it's not going to replace the sheath, but what it does is it mitigates or it cuts down the amount of tension or the amount of irritation that that particular receptor is getting, which means it'll help quite a bit with neuropathy. Now, what terpenes should I be looking for? Very specifically, you want to take a look at a terpene with myrcene, linalool, terpenoline, which is great, boronol, and germinal. Now, these are terpenes that are known to help with the neuroprotectant capability and known to focus on your neuropathy. I would suggest go back, look at the certificate of analysis for the cream, the vapes, and the capsules, and make sure that those particular terpenes are in the product. And if not, talk to your local bud tender or go to another dispensary and talk to them about making sure that the terpene profile matches what you need to be able to address neuropathy. Now, I should mention that the THC cream or the balm that you use should be something that really helps quite a bit. And what I would do is I would replace the THC cream with a THC cream that's both a one-to-one, not just THC by itself. I think we showed you one that was in the video from Air, which is AYR, and they have a very good topical cream that'll help. And it also has CBD as well as THC in it. If you want to look at a transdermal product, I would say look around. There's a couple of different dispensaries that have those transdermal products, one of them being Move and another one being Cetera. And so they have actually transdermal patches that can help you, but have THC as well as CBD. That CBD is going to help you quite a bit to be able to help you fall asleep. The second is the capsule should give you your 10 hours of relief. In other words, capsules are absorbed in your stomach. But again, go back and check out the pro-terpene profile as well as see if you can find a capsule that has CBD in it. If you're using THC capsules, I suggest you look at an RSO style capsule. I know that the RSO is much stronger. Be very careful with the dosing of RSO because of the strength of it. But the CBD THC combination, where they're working together, produces what they call the entourage effect. And that means that CBD and THC, a little bit of each of them working together, enhances the medical efficacy of both of the products. It integrates some CBD into your life with a vape that may be a one-to-one or a THC capsule that can be one-to-one. I think that'll help you quite a bit. And let me know, by the way, send me an email, let me know how that works. You should find that that'll help you quite a bit, help you fall asleep. It's not a matter of what product you're using, it's a matter of let's home in and get you the right product to use. And that might be the issue that we find here. I find in people using medical cannabis, it's usually just matching the terpenes to their particular condition to get them the relief they're looking for. Let's take a look. Are patches effective the whole time? Do they stay on? The answer to your question is they're very effective. I use patches all the time. I have 7 herniated discs in my neck, especially 3 or 4 years ago when it was still a major problem. I found that the patches were a tremendous relief. It would give me 72 hours of relief over a period, which was great. And I didn't have to worry about, did I take my medical cannabis? Did I not take my medical cannabis? What did I use in my particular case? Because I had a herniated disc in my neck, I had 7 of them. I used a THC patch that was a one-to-one. And that was because I wanted to not only get the THC to help me with the pain, but I wanted the CBD to reduce the inflammation, and working together, they worked much better. So I'd recommend taking a look at a one-to-one patch. And do they stay on? Absolutely. The problem that I had in one case, and one time I had was just trying to get it off. I'd put it in a position in the middle of my back, and my wife wasn't with me, and I had a little trouble just reaching back there and getting it off. So the answer is yes, they do stay on. They're very effective. And the interesting part is patches are one of the few products that you can take off and then you can put back on. In other words, if you've used it for an hour or two, it seems to be bothering you, or you're just worried about it, you can take it off, put the backing back on the patch, and then put it back on an hour or two later or the next day, and it'll work just as effectively. Now, pay attention to the fact that these patches will work. They have a time of 8 hours, for example, or 72 hours. They will work for that period of time. In fact, I find some of the patches actually work for a longer time than they specify. I found my 8-hour patches were working 10 to 12 hours. My 72-hour patch actually worked not 3 days, but 4 days. So I just thought I'd give you a 10. You'll feel when it's working. You'll feel when it's not working. It's something to take a look at. One of the other questions is what topical strength and strain is best what's best to start with? Well, my recommendation is always go low, start slow. So I'd recommend starting with a 1-to-1 patch, and if possible, I would take a look at a hybrid, because until you actually can hone in on what you're trying to look for, this is kind of the middle of the road. And what it'll do is it'll give you a guide as to whether A works and if you're working with the right amounts. Now, if you are in pain and you want to use a patch, you might want to lean towards the sativa side. If you're looking at just relaxing, you're stressed, anxiety, that type of thing, you might look at an indica style of patch. But I found that hybrids, staying 1-to-1 and in the middle, in my particular case, because I'm trying to fight inflammation, that CBD and that THC works together, and actually it's very helpful to be able to help me both get my life back, but also to be able to do the things I want to do on a daily basis. Next question is it okay to take medical marijuana at the same time or within a half hour of taking a prescription medication? First, let's separate this into two answers. First of all, you can take medical marijuana with your patch. Just be aware that you have the patch. So it's like anything else. You don't want to take too much of it, but you want to make sure you're taking enough to help. I know a lot of people that use patches in conjunction with, for example, drops or the tinctures. I know people who also use the patch with, and also do use smokable inhalation use routes of inhalation, smokable routes of medical cannabis. So the answer is yes, you can. Now, can you take it within a half hour of your prescription? Medical cannabis doesn't really interact with a lot of the medications from a pharma standpoint, except for medications that have to do with your heart. And that's because medical cannabis is distributed through your body, through the bloodstream. And also affects, so obviously it affects your heart and affects that whole, let's just say that whole system that's there. I don't want to get too technical in all the things that are there, but the answer is you can use medical cannabis if you are taking heart medication, but I recommend talking to your doctor and your medical cannabis doctor, because you just need to adjust the amount of product you're taking. You need less of the heart medication if you're using medical cannabis, and that's something that you want to take a look at. You don't want to overdo it and cause a problem in that area. But the answer is yes, you can. And by the way, you don't necessarily need to wait a half hour. Although it's not a bad idea to wait a half hour, let the prescription medication take effect, and then use it and find out if it works or not. You can pull it off, you can put it on, and again, that's the nice part about patches. They're wearable. You can try them and then stop using them and then put them back. Great question on this one. How much does it cost? Typically, your patches will run around $10, sometimes $12. They're typically in that area. I also a little tip. I'm a shopper, so I get the emails from the dispensaries. They always have sales. Every 2 or 3 weeks, they'll have a sale on their patches. Where, for example, that $10 patch will be more like $5 and $6, or that $12 patch will be more like $6. So you'll also be able to find them. I usually wait till they have a sale, then I go in and stock up on them because I use them quite a bit, especially if I'm traveling, I'm giving seminars, going different places. Cannabis patches are great to help me with my medication and make sure that I stay pain-free during the day, which is very, very important to me. Next question is, can lotions be used for pain in muscles? I cannot use routes due to cardio issues and THC. And the answer is absolutely. In fact, that's exactly what topicals are designed for, is to really help with pain. I do a lot of martial arts. I do a lot of workouts to support my martial arts, including walking. So the big issue becomes the pain I have, for example, in my knees. And what I found is especially the THC 1-to-1 bombs, as well as the 1-to-1 patches, work great. And as you mentioned, the lotions are wonderful products to help with that. I had my godmother had a very bad problem with arthritis in her hand. She couldn't even open up her hands, and we got her some balm products. And within 3 weeks, she was able to actually open up her hands, be able to use it, be able to cook, which she loved to do, pick up the phone, use the remote control, and things like that. And I understand if you're using different routes of administration, especially with the cardio issues where you need to, again, coordinate that with your doctor. I would be a little bit careful. But the answer to your question is this should be able to help. Now, in your case, because it's pain in the muscles, I would probably look for a transdermal product because the transdermal product goes below the epidural and goes right, sorry, the epidermis and gets right into the dermis. And that's what you really want. You want to get down into that, really get into that deep skin help conditioning to address your pain issues. And that's what I find. I typically use a transdermal product to address the pain that I have, especially when I've been working out. Now that New York, especially Long Island, has legalized recreational marijuana, will you be selling medical cannabis use there? Well, first of all, I don't really sell. I'm more of a educator, but I do work with people who do sell medical cannabis products. And the answer is they should be offering medical cannabis products, especially in a recreational state. What's interesting is there are more medical cannabis users than recreational users. However, most people who need medical marijuana or want to use medical marijuana don't necessarily know how to use them, hence why we're doing these particular seminars. And so the answer to your question is you should be able to pick up a topical at a dispensary and it's out there and you can, it's great. Again, we're not going to be selling medical cannabis products, but you can go to your local dispensary and find that. A fun fact and a fun tip, there's a product that's called Blue Emu. It's spelled EMU. And Blue Emu comes in a hemp version. You can get it on Amazon. And interestingly enough, when you look at the Blue Emu product, it is a huge, let's just say, mixture of terpenes. It's a wonderful product. I use it all the time, and it's something you may want to take a look at. It's probably one of the pure terpene products that are out there that help, and it has obviously you can check the list on all the terpenes you need to be able to help you with your painful condition. It is a topical. It is not a transdermal, but it is something that if I'm in pain and I need to address it right now, it works like a champ. And also, I'll be candid with you, not because they sponsor, but because it does work. Air has a great one-to-one product that I use. It's actually helped quite a bit, and I'm surprised at how well it helps. I know my wife had a problem the other day, and we used it, and she was surprised at how well, really, not only how fast it worked, but how well it worked with things that are out there. So it's something that you may want to take a look at. Let's take a look at some of the questions that we got during the webinar itself. And by the way, feel free to ask questions, continue to ask questions if you want to do that. What is the best product for inflammation? Well, the best product for inflammation is a CBD-based product. CBD is known for helping with inflammation. There's a whole bunch of technical reasons as to why, but just pay attention. You want to look for something that has CBD in it, and I would recommend a product that has a slight bit or some THC in it because that THC triggers what they call the full spectrum, or it triggers the entourage effect in the CBD. In other words, CBD and THC work better together than they do individually. And you'll find that if you have a product that's in that particular category, that's great. So look for a one-to-one, something that does have CBD in it. And of course, naturally, I would say that if you're looking for something that lasts all day, just for patches are great. But if you're looking for something that you just need quick relief and you want to get that relief right now, the lotions and the gels are really, really, really effective. So I hope that really helps that are out there. I'm not trying to steer you to any one particular product because you may have your choice as to which dispensary you want to use. But when you go there, really check out that patch, check out that balm. And again, pay attention to the one-to-one products. I think you'll find, especially for inflammation, it's a big difference. If you don't have a one-to-one product, you use a THC only balm, you will not get the same amount of relief as you will by using a one-to-one product, especially if you're trying to address inflammation. Doris asks a great question. It says, I cannot use vaping, sublingual, or oral due to a recent cardio HR impacts on my electrophysiology. But the lotions, balms, and creams do not seem to have the same cardio impact, but I do help relieve my pain. Do you recommend doses and frequency? And it seems that my heart reacts to THC with vaping flower, oral, sublingual oil. Will the transdermal patches have the same effect? The lotion balms don't seem to have the same impact on my heart. Well, first of all, if you're using a medical cannabis product and you're using especially a topical, you're probably using a topical and not a transdermal. And by using a topical and not a transdermal, you're addressing your pain on the skin level, but it's not getting into the dermis. And unless it gets into the dermis and goes down into the blood-brain barrier, you're not going to feel it. And that's why you're not having the effect, or you're not having that negative effect when using topicals that you would have if you were using vaping, flower, or something like that. So I would stick to a topical. It would work very well. I'd look for one that's a one-to-one. That's going to help you quite a bit. And also pay attention to the terpene profiles, if they have terpene profiles, if you can find them. It's hard to find terpene profiles on topicals. I don't know what the deal is, but there's just not a lot of information that's provided for these, not just by one dispensary, by most of them. But really, there are a few that will tell you what the terpene profile is. But if you are using a one-to-one, or you are using a product that's a transdermal, you will get the effect. In your case, because of your heart condition, stick to the topical. Stay away from the transdermal. I think you'll find it. That's really the difference that you're seeing in this particular product versus the other routes of administration. Doris actually asked if vape or flower or tincture or candles cause lightheadedness at bedtime. Is it good for sleep but not for getting up as needed safely during the night? Any recommendations? Well, if you're trying to make it through the night, what you want to do is you want to look at a route of administration or a way of using cannabis that will last between 4 to 10 hours. And that's typically, you're going to find that your edibles, your oral products specifically, will be products that help you do that. They're ingested into the stomach. It typically takes about between 30 minutes to 2 hours of work, but they do work for 4 to 10 hours. So I'd recommend taking a look at a product in that area. Now, the tinctures are going to, excuse me, the topicals are typically going to work 1 to 2 hours. So if you put them on at bedtime, an hour or two later, the effect of them is probably going to wear off. So this is where getting to use a product that is a oral product will help you make it through the night. Now the question becomes, how much do you use? Because if you're using a heavy dose of oral products, when you get up in the middle of the night, you'll be a little groggy. But if you're using the right amount, again, go low and go slow. Start with a smaller amount, find out how that works. When you wake up in the middle of the night, you'll find out how groggy you are. It's something that's there. I have found that I make what I call magic brownies that I use to sleep at night, because the brownies will help me sleep the whole night through. But there's a couple of times in my early days of making brownies, I used basically too much cannabis, and I was feeling the effect when I got up in the middle of the night, and I found I had to adjust the amount of cannabis I was putting in my magic brownies, so that not only did they help me fall asleep, but also when I got up in the middle of the night, my body was able to adjust to it and go there. So I recommend just go low, go slow, experiment with it, and you'll find something that really helps, that's really there. So take a look at capsules, take a look at edibles, which is great. You can look at, you can get brownies or cookies at your local dispensary, or candidly, you can make it yourself. So hopefully that helps in that particular area. But I would stick at something that's going to give you that all night coverage, but also don't overdo it. Go low and go slow. Find out what your particular body is used to, and find your sweet spot. That's really, really important. Next question Doris asked was great: is, do patches expire if not used? Well, medical cannabis products really they lose their efficacy. They don't really expire as much. I found that after 24 months, the patch does begin to lose its efficacy. Candidly, after about a year, it starts to use its efficacy. And I would say after about 4 years, I would say the efficacy may or may not be questionable whether it be useful or not. So I'd say I'd give it between 2 to 4 years. I typically will use my patch because I'm a medical cannabis user that need to use it on a daily basis. But I found that after about 4 years is what you're going to find. I wouldn't call it an expiry date. You can still use the product. It just won't be as effective as if you had a newer product that's there. Take a look at any other questions that might be coming up. What is best for bulging discs? Excellent question, because when I had my auto accident, I was left with 7 herniated discs in my neck, and some of them were bulging. And I would say the best thing to do, first of all, consult a doctor. Okay, don't try to attack bulging discs on your own. And your doctor will typically provide some sort of a medical treatment to help you reduce or relieve the bulging in the disc. What they're trying to do is they're trying to basically get it back into place. Now, what I did find, which is really interesting, is when I started using CBD in conjunction with THC, again, I used that little bit to get that entourage effect. I found that after about 6 months or 8 months working with my doctor, he saw that my bulging discs were being less bulging. In other words, they were going back into, as the inflammation went down, as I was doing exercising, because I exercise on a daily basis to help strengthen my neck and to be able to strengthen the muscles. I found my bulging discs were actually uh, repairing themselves. Now they're not 100% repaired. Okay, I still have a problem with my neck. I still have 780 discs in my neck, but they're just not as bad as they were 7 years ago, 6 years ago when I had my automobile accident that was out there. So what's best? A regime that has CBD with a little bit of THC in it. I would definitely use a transdermal product, a topical that would help quite a bit. And I also found that whether it's a tincture or whether it's a dryer vaporizer, which you can use, will help also to address any particular pain or any particular inflammation that's really there. I don't recommend smoking flower by itself because when you light that joint, it burns off half of the terpenes, almost all the terpenes, almost all the cannabinoids or flavonoids, and almost half of the cannabinoids. But if you use a dryer vaporizer, you can not only get the enhancement or get the best results from these terpenes, but also they don't burn off, and it's better for your lungs. You don't have burnt material. You have vape in your lungs, not burnt material, which is much better for your lungs. Other question is, do edibles expire? And it's really the same expiration date as a patch. Typically, edibles will last between 1 to 2 years without much of a problem. After about that second year, you'll find that again, it's not a matter of expiration. When we buy food products, we worry about food products going bad. These don't necessarily go bad. They just they lose their medical efficacy. And I'd say probably after about 4 years, you're going to find that they have the medical efficacy. They have lost a lot of their, let's just say their sparkle, their luster, and I'd really keep them up to date on that. So I do want to mention that if you are looking for a medical marijuana card, please look at the Medical Marijuana Treatment Clinics of Florida. They do a great job of not only getting you a card, they do a wonderful job of walking you through the first 6 months of your medical cannabis use. And more importantly, whether it's the first 6 months or you've been using cannabis for a long time, they have a call center you can call that can help you with your dosing. It can help you with your medical cannabis regime. And I think that's something that's very important. It's not a matter of getting the card, it's a matter of using the card effectively. And naturally, I recommend if you're using medical cannabis products, I really like the AYR products. That's AYR, Medical Cannabis Dispensary. They have a number of them here in Florida. I found their staff is well trained. They're very helpful. They have a great set of a broad product list that's let's just say built with not only passion but also with quality in mind. They do a great job of really paying attention to quality and making sure they have the products that are really out there, and they're very safe to use. It's ayrDispensaries.com, and I recommend them quite a bit. And naturally, if you're looking for medical cannabis information, check out our YouTube channel, Marijuana Aware, and of course these videos that we're doing on a weekly basis. Next week we'll be doing one on inhalation, one of my favorite topics and something that's near and dear to a lot of people's hearts. And before I leave, I want to say thank you very much for hanging in with us to the end of this particular video. We know it's been a while, but hopefully you got some information, and we provided some information that can help you get your life back. Topicals work between 1 to 2 hours, and I highly recommend using them. It's one of the secrets of medical cannabis. And again, you can get a lot of these products at a number of different dispensaries that are out there. Pay attention to topical and transdermal, and let me know if this works. Have a good evening and have a good week. Thank you.